Welcome to another Q&A session with my team member, Barbara. We get a lot of questions through my website, and so let's get the first question.
Okay, our first question is from Emma. Is it possible to get Botox and filler treatments if you take prescription blood thinners?
Yes, you can, but you are more likely to run the risk of bruising. So we usually advise patients to try and stop them prior to treatments, depending on what those blood thinners are. So if obviously they're needed for medical reasons, that's a different sort of scenario as opposed to someone that's taking them, say, as an anti-inflammatory for pain control or omega-3 as part of a supplement. But obviously you're going to point that out to the practitioner so that when they're doing any procedures, they're going to be more mindful of that aspect of potential bruising.
So when you have a consultation with your doctor or nurse, you should definitely tell them what medication you're on. You shouldn't forget.
Well, any good procedure is, you have that consultation and you find out whether there's any medical reasons or history or medications that they're taking anyway. That's very important.
And you mentioned aspirin. And
there's another one, yes.
You shouldn't take aspirin before you have a treatment.
Ideally, yes. Yeah, I mean, these are all blood thinners. They all
omega-3?
Omega-3 too, as well, yeah.
Okay. Our next question is from Andrea. She's 39 years old and wants to know what you recommend for smile folds. She has folds around her smile and would love more symmetry and a more youthful appearance.
So I guess what we're talking about is these things here. Yeah.
Yeah.
And sorry, what did you give an age?
She's 39.
39. Okay. So usually you're not getting jowl formation or descent of tissue. So where you have good skin integrity, elasticity, a good treatment for these would be using a very fine filler in a special technique to support the underlying, the subdermal layer to stop these folds from occurring. So typically we're going to use something like a skin booster type of filler, which doesn't give volume or projection, but is really restoring some of the integrity of the skin, the hydration of the skin, particularly in these areas here. Yeah, that's what I would recommend.
Okay. Tess wants to know if it's possible to lower one eyebrow to align it with the other. The right eyebrow is significantly higher. Is it possible to lower the higher one to align with the lower eyebrow? She's not interested in raising the other.
You can do that, and I do it with my patients where there's a significant asymmetry between eyebrow heights. Again, depending on the actual assessment as to whether you want to lower it or whether you want to higher the other one, because if someone already has brow ptosis, you may not want to necessarily make that worse by lowering the other side. In fact, you may actually want to give some brow elevation, and so you would do a different dosing regime one to the other. So that's something I do quite a bit, actually. So it's not difficult to do, but it's better to do it through review, go low doses and then review, so that you don't get eyebrows shooting off your face.
Okay. John is asking, what treatment would you recommend for a more defined jawline for a better profile? We get a lot of questions from men regarding their jawline.
Yes, and that's a lot of the work that we now do is actually on chin and jawline contouring. And again, it goes back to a full assessment because it will depend on the age. It will depend on typically how much tissue is descended, skin integrity. So there's a range of options that you would use typically with fillers. But where you place those fillers, again, depends on that assessment. So if you've got a large jowl, you're typically going to put filler around the chin and the post-jowl, or the pre-jowl and post-jowl. If it's really just defining a jaw In a younger person, then you may be using filler along the jawline itself. Have they lost any support at the angle of the jaw? We're going to put some filler there. That depends on how wide this angle, this distance is. So there's a number of factors to consider when you're doing jawline work.
Okay. Well, that's it. No more questions.
All right. Well, thank you very much. If you do have any more questions, please go to my website and submit your questions through that. Thank you.